I want to welcome you to our 6th annual Dr. Stone 4-part educational webinar series. This is our second part of this webinar series that we're doing this month. So I hope you guys enjoy it. My name is Jeanette Rodriguez, and I am the program coordinator with the Riverside Medical Clinic Charitable Foundation. And first off, I'd like to thank our sponsor, the Riverside Medical Clinic, for all their support. I want to introduce Pia to you. Pia is the owner of the Artisan Palette, and it was through her passion of fine dining and delicious cuisine that she decided to learn about clean eating. As she was able to see the cracks in what was called homemade or made fresh, she took matters into her own hands. She educated herself, her family, and her team, and brought awareness on food and its impact. Adjusting mindsets away from dieting and towards lasting longevity is one of her many great accomplishments that Pia has been able to share with the community.
So Jeanette, thank you everyone that has joined in today. Thank you also to Alina, who's helped put this together. I'm very grateful to be spending the next hour or so with you today, and sorry for the technical difficulties. So I was asked today to put together or to speak today on how your gut impacts immunity and mental health. I'm really excited about this topic. I hope you are as excited as I am. I'm going to have a section in the very end for questions. So if you can hold on to your questions, that would be awesome. Alina, can I get you to switch the slide, please? Thank you. So as Alina said, I'm the owner of Artisan's Palette. It's a market in Temecula, and I've owned it since 2013. In fact, in the next week is going to be our 7-year anniversary, so super excited about that. And before I opened my market, I thought I was a clean eater. I thought I was doing everything right, listening to, just vague type of descriptions like, oh, if it's homemade, it's clean, or, oh, if it's local, it's clean, and eat fruits and vegetables, and these types of things. I really bought into it. And then I learned after I owned my business and after I started it that there was a lot more to clean eating than just that, and a lot of diet lanes like vegan, and I'm not against veganism, or keto or paleo, kind of hijack the term clean eating. So I'm going to go through a little bit of that, pepper it a little bit throughout the presentation. So with everything that I learned, I created a course. It's an online course. It's called Get Food Smart, Get Real. And you can learn more about it on, if you go to it, getfoodsmart.com. And it's more about adjusting your mindset away from dieting and toward lasting longevity. So it has nothing to do with me telling you what to eat, but it has everything to do with me educating and informing you on making better choices. And that really is the third paragraph here. Is I found that nutrition affects more than your physical health. There's definitely no one size fits all. It just doesn't work. That's why diets just don't work, because there isn't a one size fits all. And it's your journey is understanding how your choices impact your optimal wellness. And we'll learn that as it impacts our gut health and brain health. Next slide, please. So here are our objectives today. We're going to talk about that gut-brain connection, how your gut is your second brain. It's not just an idea, it's actually proven. Systems that communicate. A big discussion here with gut dysbiosis and leaky gut, which we'll get to. Foods that can cause gut issues, and then foods that can heal gut issues. One of my favorite things to talk about is strategic eating, and it's something I talk in depth in my course, and I'm going to introduce that idea to you today. Also, pathogens in our immune system, and then tips for our whole body wellness, things that don't cost anything to do. And then we're going to open it up to some questions and answers. All righty, let's get to it. So we'll go to the next slide, please. Okay, so your body has two main nervous systems. One is the peripheral and one is your central. So we probably are all aware of the central nervous system, but we're going to concentrate or focus on this. And this slide is the only kind of science slide there is. So bear with me as we get through this, and then we'll, continue to move on. So the peripheral nervous system has a system inside that one called the enteric nervous system. And this is also referred to as our body's second brain. Okay, and it's comprised of 100 million nerve cells that line the stomach and digestive tract. It regulates nutrient absorption and blood flow and sends signals to your brain that can play a huge role in one's mental state. The main messenger that passes all this information to your brain is the primary visceral nerve, which runs down the front of your digestive tract from the esophagus to the colon, and that's called our vagus nerve. And I'm going to bring this up again. We're going to talk about that in another couple slides. Okay, so next slide, please. Okay, gut feeling. How many times have you made a decision based on your gut? I know I tell people that all the time. I said, what does your gut tell you? What's your intuition? It's so important to listen to it, okay? How many times have you felt butterflies? Or how many times have you had knots in your stomach? So a lot of the information that I got in the next few slides, 3 to 4 slides, is from Dr. Mayer. He's the professor of medicine and physiology and psychiatry and biobehavioral sciences at the UCLA Oppenheimer Center. And he spent the last 40 years building a scientific case for the link between, and the for sure link between the brain and the gut, often calling into question the conventional medical wisdom. And so let's take a look at him. Our next slide, please. So this is him. This is Dr. Mayer. And he, again, spent 40 years and continues to study this. The gut converses with the brain like no other organ. When people talk about going with their gut feelings on an important decision, what they're really referring to is an intuitive knowledge based on the close relationship between our emotions and the sensations and feelings in the gastrointestinal or the GI tract. And then this goes back to those butterflies. These gut sensations go in both directions. When you eat too much or have certain fatty foods, the changes in your gut can affect your mental state. And sometimes we refer to that as, if you guys heard of the term hangry, hungry and angry at the same time. So this kind of falls into that category. And then he also says, when you feel butterflies or a rumbling in your stomach, when you're nervous or knots in your stomach, when you're angry, that's your mental state is affecting your gut. Okay, so we'll go into the next slide. All right, so this was very interesting to me. He's convinced that the brain-gut axis isn't a linear system, and that's part of years ago when I was still learning, and I'm still learning. That's the most important part of all of this, is that nobody knows it all. And in fact, even Dr. Mayer is still learning, he's still studying, and the science is always changing. But this was an important point to really understand, is most doctors still consider this a linear system, that it's just the gut to the brain, brain to the gut. But he feels like this is more of a circular feedback or a loop, as the image shows it, through multiple communication channels. So like I mentioned to you before, a couple slides earlier, that one is through that vagus nerve that runs through that enteric nervous system. Then you have the brain and the immune system. So the gut hosts the majority of the body's immune cells. And then also the brain and the endocrine system. The endocrine system is your communication, basically your hormonal communication between your thyroid, and sorry, I've been working all day today, so my brain is running out of steam here, but they sit on top of your kidneys, your adrenals. So you have 2 adrenals, one on either kidney, and then you have your thyroid. And so the two of these and that communication is your endocrine system. So a lot of hormonal data goes through that. So underneath the image that you see there, it says the gut and the brain are closely linked through bidirectional signaling pathways that include nerves. So that would be that vagus nerves, hormones, the endocrine system, and the inflammatory molecules. So we can go to the next slide, please. Okay, so what happens when there's a failure to communicate between those three systems? When the communication channels go awry for one of a variety of reasons, that includes poor diet, stress, or illness, the result can be physical health problems such as digestive disorders, which we're going to talk about, obesity, and mental health issues such as anxiety or depression. So Dr. Mayer notes that it's no coincidence that most patients with anxiety or depression also have abnormal gastrointestinal function, okay? So when we start talking about poor diet, most people don't really know what that means because they really don't know what a good diet is either. And that's where we have to start working a little bit harder. And I'm going to introduce some concepts in this presentation for you to start to understand that and put more of the descriptors in there rather than just words like poor diet, good diet. You know, what does that mean? So let's go to the next slide, please. Okay, so gut dysbiosis and leaky gut. So what does this mean? These are some big words, and some of you may have heard some of these terms before. So let's first just get definitions out, and then let's just drill down a little bit deeper. So dysbiosis is an actual medical term for imbalance. And for our purposes today, specifically in the flora or microbiome of the gut. So those are the bacteria and the good bacteria that we have in the gut. There are a lot of factors that can contribute to this, most commonly poor diet. So there we hear that word again, poor diet. Also, what you might not know, what causes a lot of dysbiosis is antibiotic use. Also, overuse of alcohol and exposure to certain molds and mycotoxins. And the molds and mycotoxins go back not just what we might have in the walls or lurking in the air system that we have, but also there's a lot of mycotoxins in the foods that we consume. So that's another area that we have to be aware of. So poor diet, antibiotics, overuse of alcohol, molds and mycotoxins are all ways in which we can achieve this imbalance, also known as dysbiosis, in the gut. Now, long-term gut dysbiosis can lead to even a more serious condition, which you might have heard is called leaky gut. And the medical term for this is intestinal permeability. And then this occurs when the walls of the intestinal tract become more permeable due to a long-term stress and inflammation within the digestive system. So the results in nutrients not being processed properly, and common symptoms are bloating, fatigue, digestive pain, and skin issues. And these are just some of the symptoms. There's a lot more. Okay, so if we tie this back to antibiotics. So I just want to give an idea here. When I see people in my store and they've taken antibiotics, and by no way am I against antibiotics, it's not a for or against or anything like that. It's just simply understanding what happens if I take antibiotics, what's the hit that my gut is going to take. So I try to tell people, if you've decided that you really need the antibiotic for whatever your ailment is, then at least know that you're 6 months into just trying to heal the damage from that antibiotic, okay? And so we're going to talk about how do we heal, what are some of the things that we can do to heal, but just so you can get a time frame to understand, okay? And that doesn't include the poor diet that you may or may not have, the alcohol consumption that you might have done prior. It just means that's the hit that your gut is going to take from that from taking the antibiotic. Okay, so let's go to the next slide, please. Okay, so foods that can heal versus foods that can harm. So let's go to the right-hand side and look at this list, because a lot of this has to deal with identifying like what is a poor diet. Okay, so a lot of us know that sugar isn't a good thing to have in our diet, but we ignore it because it tastes so good, right? So it's like, oh, it's somebody's birthday, which inevitably, if you come from a large family, is like every week or minimum once a month. And of course you have to have, you know, a piece of cake, right? And how many times will you say, well, one bite isn't going to kill me? But it's not really the one bite, is it? It's the mindset that you're saying the one bite isn't going to kill me. So these foods collectively is what the problem is. So it's items that you might think, oh, I'm going to put barbecue sauce on this, or a salad dressing, and that's filled with sugar. And it's filled with a lot more things, but I mean, sugar in this case is not the great ingredient, but there will be other ones too. Then we have gluten and grains. So these are foods that are shown and known and proven to cause inflammation. Okay, so gluten is a protein, and you don't have to have celiac disease, which is an autoimmune condition, to not be able to process gluten. So many people will say, oh yeah, I can have, you know, pasta and breads and stuff. It doesn't bother me. Well, you might not have a direct response to it after you've eaten. It could be collectively over years. And then what ends up happening is somebody will say, all of a sudden, I couldn't eat blah, 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 whatever that is, you know, the underlying, whatever that is. And then we go, well, it's never really all of a sudden. It's gradual. And these are the things, these gradual items in the foods that can harm, that eventually catch up. Okay, grains is another one. We're known that it causes inflammation. Lectins is another protein that is found in a lot of foods. For example, if you love tomatoes, so the tomato, the skin of the tomato and the seeds of the tomato are where the lectins are. So you might say, oh, but I eat lectins all the time, or I eat tomatoes all the time. And go, yes, you probably do. And then that collectively with the gluten and the sugar and the other items is what eventually causes these types of problems. And then it leads to us saying, again, that term, all of a sudden. The industrial oils are everywhere. This would be something like canola oil, which we've been told is a healthier fat, and use the canola oil. No, this is not a good ingredient to have. And they're all under the label of vegetable oils. So there would be canola, peanut, grapeseed. There's so many of them, but those would be the industrial oils. So better oils would be olive oil, avocado oil, even sesame oil would be better oils to have than the industrial oils that we find in almost every single ingredient or every single product. Preservatives is another one. They put a preservative in everything, and I've owned my store for 7 years, and I can never understand this because I have products that are pure, clean, delicious products that don't have any preservatives in them, and they last. So I don't get it. Antibiotics, which is what we talked about, and then processed food, which are also known as just industrial foods. That can be whole foods or processed foods. So these are some of the foods that can harm. Obviously, antibiotics isn't a food, but these are some of the foods that can harm. So we go, okay, what are some of the things that can heal the gut? Okay, so this is my list on the left-hand side. So probiotics is a good one. And we're going to focus on probiotics for the presentation. And if we have time and if there's questions, then I can go back to collagen and some of the other items. But probiotics, collagen, bone broth, enzymes, yogurt, and leafy greens. Now, just because it says yogurt doesn't mean it's actually a good yogurt to have. So these are all things that, yes, they can be good, but if we don't really know about them, they can actually be harmful. And so that's what I want to educate you today on, is like these types of terms, to make sure you're leaving here knowing what you can look for. So let's go to the next slide, please. Okay, so probiotics. So what are probiotics? They're basically live microorganisms, usually they're bacteria, that are similar to the beneficial microorganisms found in the human gut, that are taken as dietary supplements or found in foods. Most probiotics are bacteria similar to those naturally found in the intestine, and common examples are lactobacillus and bifidobacterium. And so I just want to digress just slightly from this, because there's a lot of people that will say, when they're clean eating, if you ask them a definition and say, oh, well, what do you think is clean eating? They'll say, well, if I can't pronounce it, then I don't buy it. Well, a lot of people cannot pronounce lactobacillus and bifidobacterium, and these are actually good ingredients to have. So they might leave it out because they're just like, I don't even know what that is. So this is why understanding, asking questions, knowing what the ingredients are so important. So when we go through and say probiotics might help with the following conditions, so for sure there's IBS, that's irritable bowel syndrome, constipation, diarrhea, weight loss, for sure. There's a lot of different bacteria, like probiotics, that will help with that. Question is gassiness. Yes, correct. That's another that would be in that form of, digestion issues, brain health, heart health, and immunity. So probiotics can help with all of those items, or with all of those conditions, provided we pick the right probiotics. So let's go to the next slide, please. Okay, so I created this slide to kind of give you an idea of all the different probiotics there are, and then how you can make better choices when you go and look and pick your probiotics that you're going to take. So lactobacillus is a type of probiotic. So you see there in my first bullet, I have actually three types of lactobacillus. So there's Lactobacillus gasseri, Lactobacillus rhamnosus, and Lactobacillus, a combination of rhamnosus and Bifidobacterium lactis. So when we look at those strains of probiotics, those are good to help you with the weight loss. Okay, then we look at, there are 2 different types of lactobacillus in here and 3 different types of Bifidobacterium. So there's Bifidobacterium longum, Bifidobacterium brave, and Bifidobacterium infantis, combined with Lactobacillus helveticus and Lactobacillus rhamnosus. That's good for brain health. Okay. Then we go into a very, very popular one, like in almost every single probiotic, you will have Lactobacillus acidophilus. That's probably the most common bacteria, okay? And so it's in almost every single, like yogurt, and I'm going to talk about these a little bit more, but that's probably the most popular. And this one here, this line here, Lactobacillus acidophilus, Bifidobacterium longum, and Lactobacillus reuteri, all of these 3 are super popular probiotic strains that you're going to find in almost every single probiotic that you would go out and buy. Okay, then there's a Lactobacillus GG. This one here you don't find a lot, the crispatus and Lactobacillus gasseri. And then the other 2, Bifidobacterium bifidum and longum, they are good for immunity. Okay, so now we're starting to understand that we're moving away from just the big term called probiotics to understanding the types of strains that are found in a probiotic, and then what those strains are good for, whether they're good for our brain health, whether they're good for weight loss. trying to get to the crux of it, right? Of understanding, here is my issue, and then here's my issue, and then these are the strains that are going to help with that. So let's go to the next slide. Okay, so a concept that I teach in my course called Get Food Smart, and something I talk a lot about when I talk to my customers, is this concept that is strategic eating. Okay, so we go back and we say, okay, those are the strains that are important to us, but then how do I get those strains? So we know that if we buy yogurt, okay, whether it's dairy or non-dairy, though we will get probiotic strains in them, okay? Acidophilus will definitely get in there. Butter, whether it's dairy or non-dairy. And again, I'm not promoting that you should be taking these products, right? Because we have the clean versions of these items and the not so clean versions of these items. So that's the second part of this, is understanding, oh, that's the type of food, so yogurt is the type of food, but what's the best yogurt to take? Okay, same with the butter. Butter is the type of food, but what's the best butter? And I'm going to give an example of the butter in a second. Then there's kefir. Kefir is a drink that you could make. It's a fermented drink that you can have that's either dairy or non-dairy. Some of you might have heard of kombucha. There's also jun. So I can talk, and if you guys have questions on these, just jot them down and I'll answer them at the end of the presentation. So if you want to know the differences between kombucha and jun, I'm happy to talk about that. Then there's sauerkraut and kimchi. Then there's beet kvass, and there's other fermented foods. So these are just some of the foods that you'd find in your local market that can be high in probiotics. Okay, so now I'm going to digress just for 1 second, just to prove a point of understanding strategic eating. And let's talk about butter. Okay, so if we're doing strategic eating, and I talk about this in another slide, it'll say, does this food help me or does this food hurt me? Okay, so you might say, oh, I'm lactose intolerant. I have to be non-dairy, so I'm not going to eat butter. You go, okay, good. Most people are lactose intolerant, whether they know it or not. So we start to understand and go, well, why? Why is that happening? Okay, a lot of us don't produce the enzymes that are required to break down these types of foods. So in this country, most dairy is produced from 2 types of cows. They are called a Jersey cow and a Holstein cow. Those are the 2 types of cows in this country, and all the dairy comes from those cows. Now, those are the 2 types of cows that are found in almost every single country except for France, and for a little bit Italy as well, but mostly France. So France creates their dairy, but they don't use those types of cows. Holstein cows, Jersey cows. They have different types of cows. Okay. Now, we say, okay, that cow in this country, whether it's a Jersey cow or a Holstein cow, produces a protein, which is a casein. Okay, dairy has 2 types of caseins, casein 1 and casein 2. And this is generally more about the butter that from the Holstein cows, or dairy from the Holstein cows or Jersey cows, produce casein 1. And that one is very hard to digest. Okay, so that's usually when people are non-dairy or cannot digest dairy, it's because of that specific protein. Now in France, when you get butter or cheese from there, those types of cows produce a protein called casein 2, and that one is much easier to digest. So you might be saying, oh, is that why I can take goat's milk or goat cheese and goat products? And the answer would be yes. If you ask that question, it's because goat products produce casein 2, and generally people that can't have cow dairy but can have dairy from a goat or a sheep. Okay, it's because of that it's because of that protein, which is casein 2. So I just digressed a little bit just to identify it's not just about going and buying butter. It is understanding what is the better butter, right? What is the better yogurt? So it's not just about running out and getting a brand name like Activa or, oh, I do Greek yogurt. It doesn't matter, okay? You need to understand the process that was taken to make the Greek yogurt or the coconut yogurt or whatever it is that you're going to ingest. Let's go to the next slide, please. Okay, so part of this and part of what I'm teaching you is I created several years ago the 10 Commandments for Clean Eating to help people, because people would say, well, you know, you're so knowledgeable, you know so much, like where do I start? How do I just start to understand what I'm getting? Because how would I ever know that the dairy is from Holstein cows and Jersey cows and produce casein 2, you know? How would we ever know that? Or casein 1 rather. So I created this list called the 10 Commandments for Clean Eating. And the first commandment is let the ingredient list guide you. That's the first commandment. And you can find all my commandments online at getfoodsmart.com. And I'll go through some of that with you later as well. Okay, so, and it goes back to what I just said. Every time, it's just a mindset shift, right? You look at something you're about to ingest and you go, is this going to help me or is this going to hurt me? That's it. That's the question you have to ask yourself. And then you go, okay, what's my return on investment? Not just monetary. What am I going to get from this item? Is it going to help lessen my inflammation? Is it going to help heal my gut? What are the things that I'm going to get from this item which I'm about to consume? And if you start that, okay, that is your first step on your journey toward clean eating. That's the first step. And you just ask that question and start to look at the ingredients. You are on your way from moving away from a diet, which never works, toward your journey for lasting longevity. Okay, let's go to the next slide, please. Okay, so let's switch gears a little bit, but it's still intertwined. That now we're going to talk about the immune system. Okay, so what is the immune system? It's a set of tissues which work together to resist infections. The immune mechanisms help an organism identify a pathogen, which I'm going to explain what a pathogen is, and neutralize its threat. The immune system can detect a difference between the body's own healthy cells or tissues and foreign cells. And I want to remind everyone that everyone is born with an innate or natural immunity. It's our own type of general protection. So no, we cannot live in a bubble. They made a movie of that, Boy in a Bubble, I think in the 80s. It was a bad idea then and a bad idea now. So we need to be exposed to pathogens to really understand, to work our immune system. So let's get to the next slide, please. Okay, this is my favorite slide for sure out of this whole presentation, okay? Why? Well, let's go through it and let's really dig deep into here, okay? So first of all, a pathogen is defined as an organism causing disease to its host. So there's all types of pathogens. Viruses, the past couple months, I think we've heard about so many things about viruses. Bacteria, fungi or fungi, and parasites. Now, the next part is why this is my favorite slide. Okay, and let's just read it out loud and then sit on it. Okay, it has been estimated that there are over 380 trillion viruses inhabiting us. There's approximately 40 trillion bacteria. And wait for it, because this is the best part, okay? The human body is made up of 30 trillion cells. Okay, so let's just read this again, because this is unbelievable, right? We're more than 380 trillion viruses inhabiting our body and approximately 40 trillion bacteria. So we are just one big germ fest, right? But yet everything works. Everything is supposed to work, right? Our immune system works if we're choosing good, making good choices for our diet, that'll work. And everything's meant to work in this like symbiotic way. Okay, so I've had several people, and you might want to do this for, and we're going to talk about anxiety and stuff in a couple more slides, but I have people that have gone through major illnesses, through cancer, through all sorts of things, and they start talking to a cell. And at first you might go, okay, that sounds a little cuckoo. But when we think back, we go, well, we're so in tune with our body, right? And then when we look at this, we go, oh my God, over 380 trillion viruses and approximately 40 trillion bacteria. I didn't even talk about the fungi and the parasites, okay? And then we only have only 30 trillion cells. Let's talk to ourselves. Let's find out what like cell 182 is going to do for us today. So people will come in and like just meditate on one of the cells to basically say, okay, we're going to talk about 182 and I want you to really go for me today, work on, and then they fill in the blank. So whatever it is that you're trying to work on. So we're going to talk about meditation and stuff in a few more slides, but this slide I think says it all of how amazing our bodies are, that we're filled with all these viruses and bacteria, and it doesn't mean that the viruses are out there to kill us. We're there to build our immune system and for our immune system to help to ward off anything that might come in that's foreign to us and is going to try to hurt us. Okay, so let's hit the next slide, please. Okay, so boosting our immune system. Okay, so another one of my favorite slides, because guess what? This doesn't cost any money. Okay, what can you do right now to help your immune system? So scientists are linking a person's mental state with their immune health, and people who have chronic mental conditions are statistically more likely to also suffer from chronic health problems. So if you're looking to support your immune system today, right now, when we get off the phone, here's some things that you could do. Look at your sleep patterns. How well do you sleep? If you're not sleeping well, if you're having a hard time going to sleep, staying asleep, whatever, not getting enough sleep, this is one of the systems that you need to fix. Okay, so all of us should know how many hours your body requires. My body requires 7 to 8 hours of sleep. And when I don't have it, it's not that I'm grumpy. I just know that I'm just not my best. My brain's not firing, just not my best when I don't have enough sleep, okay? My husband's closer to 10 hours. And so all of us should have a number of what we require, what our bodies require to have good sleep. And I'm sure when you've slept all night like solid, you're up and you go, gosh, it feels so good, okay? So when your sleep is not working for you, we need to talk about that because that's one of the first things that you need to get in order. Then it's drink plenty of good water. And again, you decide the water. A lot of people have these equations, you know, it's half of your body weight in liters, what you should be drinking. I don't really subscribe to any of that. I just subscribe to where's the water? Where did it come from? Let's hope it didn't come from a tap. And then if it did come from a filter, what kind of filter? I prefer to just drink pure mountain spring water. And we have an excellent source here in Southern California. It's called Mount Palomar, okay? It's high up on the mountain. So it's super clean water. Yes, it goes through their own filtration system, but the source is a mountain, not a tap, okay? So understanding what makes good water. And then a part of the 10 commandments for clean eating, commandment number 8 is get your body moving. And this doesn't require, you know, running a marathon. If you have a pet, take the pet out, go for a walk, stretch, just get some movement for your body every day, okay? And that helps boost your immune system. The next part here is proper elimination. So this is going to the bathroom, okay? And that's urination, both ends, okay, or both parts. Because this is amazing to me. I will have people that come in my store that have not gone to the bathroom for 8, 10 plus days, okay? I'm here to tell you that if you're not going to the bathroom every day, you have a problem. That's it, okay? Plain simple. You have a problem. And it's up to you to understand the tap on the shoulder that you're getting to say, oops, okay, why am I not eliminating every day? I better find out why and work toward that. Okay. And finally, and something that will help you is back to what we talked about, the probiotics, right? The probiotics have good bacteria that will help you start to eliminate every day. And then stress management is huge, mindful practices, and I have some tips for that toward the end of the presentation. So all of those things don't cost any money, and it's for you to look, that's just helping your immune system. Because remember, we only have 30 trillion cells. That's not a lot. And so if our cells are out trying to fix the sleep problem, fix the elimination problem, and fix all of these other things, how is it going to have time to go and actually ward off the bacteria and viruses that we're going to get, right? So we have to really see the perspective in this. Okay, let's go to the next slide, please. Okay, supplements for the immune system. Okay, I've just listed a few of my favorite ones here, but this goes back to the quality of things, which I have a slide for this. So it goes back to food and for supplements. So you can say, oh, I've gone to fill in the blank, big box store, whatever, and I picked up vitamin A. So vitamin A is so important for your immune system. So these are supplements that we're talking about, right? But not all supplements are made the same. Just like if you were to go out and understand the differences between poultry or understand the differences between red meat, you would understand there's a big difference between something that you would get at the supermarket versus something that's truly pasture. Vitamin A is, and the reason I say that is because where do you find vitamin A in the food source would be something like beef liver, super high in vitamin A. Carrots are also high in vitamin A, but the number one source for a good level vitamin A would be beef liver. But again, not beef liver that you find at the supermarket that's all industrial grown. That is actually worse for you. So I wouldn't be taking that. So it's again, understanding the source. So many people take vitamin C, and I absolutely ask you right now, write this down. And then when we're off the phone, I want you to go in and look at your vitamin C. And if it says ascorbic acid, that is not vitamin C. That is the chemical version of vitamin C. Okay, so vitamin C, the food version, the superfood version of vitamin C are things like camu berry, acerola cherry. These are all, those two in particular, are the highest sources naturally of vitamin C. Okay, vitamin D3, the same thing. Sometimes you want it to take it with vitamin K2. That's another really important vitamin because K2 is what takes calcium to the right parts in the body. So it's D3 and K2. So that's a good one. I don't want to digress too much on the K2, but we can, if you're really curious and you have a question about it, we can take it up in the Q&As. A really good multi-source of B vitamins that goes beyond just B12. So there's a variety that I recommend, or a specific one that I recommend, and it's excellent because it's a B1 through 12. When you have a blood test, the blood test will show your B vitamin specifically and then your B12. So I always recommend that you take a multi-B vitamin in a liquid form, and again, understanding the source. And then from there, if your second line in your blood work says you're short on B12, then you would take a separate supplement for B12. Then minerals that I really like are zinc and selenium. And again, great zinc is what you could find in beef liver. Zinc is also, I have it as a separate tincture that you could take. Same with selenium. Really easy selenium that you could take if you don't want to take a supplement is just to eat up to 3 Brazil nuts a day, and then you'll get your recommended dosage for selenium. So there's zinc and selenium, great minerals, and found in organ meats is another really good way in which you can get that. Medicinal mushrooms, I take so many a day. So there's lion's mane, chaga, reishi, cordyceps, and there's several other ones. Turkey tail's another one. So that is excellent to help your immune system. And if you're already compromised with maybe having a cancer diagnosis at this point or an autoimmune condition at this point, I strongly recommend medicinal mushrooms as part of a plan. You know, it's not the be all end all. There's no, you know, silver bullet in any of this. It's a combination of things. And then propolis, probably one of my favorite supplements to take. I don't take it daily, but I do take it. It's one of these things that I rotate in and out. It is up to 80% as powerful as an antibiotic. It's something that bees produce. It's like a waxy resin, but I don't take propolis from the bees that are in this country, which are basically honeybees. I take it from stingless bees that come from Southeast Asia. So it's a very specific type of propolis. So those are some of the supplements that I would recommend that you take to help boost your immune system. But again, remember that none of this will really work if you don't have the mindset of understanding the foods to combine with this, right? So if you're taking a bunch of supplements, but then all of a sudden you're driving through Del Taco or fill in the blank every single day, how is that working? We're making strides forward and then back and forward and then back. So we have to really understand that this goes, there's 2 tracks, your cellular track, which is part of your immune system, and your nutritional track. Those are the foods that you decide to eat and the choices you make on a daily basis. Those 2 tracks need to kind of flow and go together. Okay, so the next slide, please. Okay, so as I created, like I said, the 10 commandments for clean eating, where commandment number 1 is let the ingredient list guide you. And I also created this pyramid. This is called the What Are You Buying pyramid. And I created it to help people understand that you can't make a change until you understand what you're buying. And this isn't in a judgmental way, it's just in a factual way. So once you understand what you're buying, then you can make better decisions. Like you could understand return on investment. You can understand strategic eating. All these concepts that I talk about in my course, these are things that you can understand just by picking up these basic concepts that I'm teaching you today. So all the food, so that bottom row, it's called industrial food, all the food that we buy, whether it's a whole food like an egg, an avocado, an apple, a steak, okay, it's industrial food. And it was farmed and raised industrially. And to learn more about it, you can go on my website and learn more about that. But also in this level is any processed food. So a Pop-Tart and any type of everything's been processed to a certain extent, but I mean cereals, things have been fortified, so they've taken things out and then added things back in, which are the chemical versions of stuff. That's all industrial food. 95% of the people are eating industrial food. And that's true whether you're on so diet lane means nothing, right? If you're keto, paleo, vegan, doesn't matter. You can do any one of those diets at the industrial level. It doesn't mean it's clean, but you can be a vegan, you can be plant-based, you could be keto, you could be paleo, you could be vegetarian, all at the industrial food level. Then up to 5% of the population want to do a little bit better. So they start to seek out things that say organic, okay? This is industrial organic. Not that it's bad, it's just to understand it, because you can still have industrial organic canola oil. Okay, that doesn't mean, and the industrial version is canola oil. So just because it's organic doesn't mean it's better. It's still going to impact inflammation markers. Okay, you can have regular sugar, cane sugar, and then you can have organic cane sugar. Okay, it still doesn't mean it's a good ingredient to have, because it still means that it impacts your inflammation. Same with grains, right? Oh, I'm going to have an organic wheat pasta. Okay, well, it still has lectins in it, and it still has gluten in it. So it doesn't mean that your body can just because it's organic doesn't mean it's clean or a good choice. Okay, so that's industrial organic. The next level is, that is an oxymoron. It doesn't exist. Industrial pasture, it's a complete lie. So this is where you'll find you'll actually think you'll be paying more, but you're not getting more. So there'll be things like grass-fed, grass-finished, free range. Unfortunately, even the term pasture is getting muddled in here. And so you think, because you think the term free range, immediately a picture of birds happy on a pasture and flying around and jumping around and eating bugs, that's what goes in, that's the picture you have in your brain. Okay, well, I'm here to tell you, cage-free doesn't mean that. Cage-free is all the way down at the industrial food level. The bird is still in a silo that's 2 miles long, and they're still getting fed industrial grains and soy, and what it means is, in the day, 2 hours out of the day, a trap door gets open, and if the chicken can go out, then they can go out. But that's it. That's what cage-free means. Okay. So there's so much deceptive marketing, which is commandment number 3 of the 10 commandments of clean eating, that it makes your mind crazy. So you just go, okay, got to take a deep breath here, because we know the system is broken, but we could just start slow, right? Start with one step at a time. Start with one thing that you can change. And you go, what can I change? You start with, what do you love the most? Do you love, do you have a 3 o'clock sugar dragon? Do you have an 8 o'clock salt monster? What do you have? And then you go, okay, I'm going to keep that pattern that I have. I'm just going to pick the better version of it. Okay. And that's, again, being mindful and making your first step and strides toward lasting longevity versus just following a diet. Then above industrial pasture, so the next level, local organic, local pasture, this only really refers to meat products, like dairy and eggs, and then also produce. So like today, I got, both at my home and at my store, we get a local box delivered to us that was all harvested this morning. So everything was in the ground. And then this morning they harvested it, they put it in a box and or a bag, and then we have it delivered to our house today. So we support a variety of different CSAs, which are community service agriculture. And then, of course, the very, very best is for you to grow your own. But honestly, I don't have a huge green thumb. I try. I have a garden. I have an herb garden as well. I fail all the time. It's horrible, but I try. I keep planting stuff. I keep working at it. I learned last year I should never plant tomatoes next to cucumbers. I didn't know that. They hate each other, apparently. So they're good in a salad, but apparently they don't like to grow together. So, okay, I learned that lesson, So now just keep trying different things. So that's the point of this, that's why it's a journey, right? It's not about just getting to a place. It is absolutely a journey. Okay, so let's go to the next slide, please. Okay, so healing your gut. here's some things just that you can do, again, that really don't cost any money or very little. So there's all those things that I talked about, but what about lifestyle things that you can do? Okay, not everybody can meditate. I get that, okay? I'm still learning how to meditate. I'm horrible at it, but it's something I like to try. And one of my best recommendations to start off is, he's an expert. I'm sure many of you know him already. His name is Joe Dispenza. He's got many different credentials. So if you're looking to do meditation and learn more about this, my recommendation would be to look up Joe Dispenza, maybe even buy his book and start there. Journaling I like a lot, and I like to do it with a physical book. So I like to buy a pretty book. I don't know, maybe it's a girl thing. I don't know. But think about it. You know, if you want to do this, buy something and then write it down. And I like to see my progress, you know, of a variety of things that I do. And that's part of the reason why I journal. And so where I am today, if you would have met me last year, you would have thought, oh, wow, she's so clean and this and that. And I am. I'm a super clean eater. But this year is another level for me. So that's why it's like, you know, every year I'm like, wow, that's a big change that I just made. And I would have never have known that I was making it. So that's a nice thing about the journaling. Stretching, just go on YouTube. I mean, there's so many different resources that you can go on, and they're different levels. So everything from just like stretching very simply to something that can be a little bit more challenging, you'll find it on YouTube, and they're all free. And so you could just look up there. And then deep breathing, one of my favorite methods is the Wim Hof method. So look that up. I'm not an expert in this. I try to practice it because I'm trying to do a little bit more cold therapy. And I tried this a year ago and failed miserably. But as there's a theme here, right? I keep trying. And so I'm introducing it back into my life because I know how good cold therapy is. And so with this breathing technique, I should be able to stand under a cold shower for like 5+ minutes rather than the 30 seconds, if that I was able to handle before. So, and then I journal that, right? I've spent, you know, now I'm at 45 seconds. Wow. And I take the win. So these are all really good lifestyle tips that you can do. And what I want to talk about here too, just to digress just slightly, is let's say you already have a habit that isn't the best habit, okay? I'm going to use myself an example. 4 years ago, my habit was I would come home after the store and I would open a bottle of wine and I would start cooking, and I would have a glass of wine while I was cooking, and then while I was eating, I would have a glass of wine, and then I would have another glass of wine toward the end of the meal. So, and this is, I was still drinking California wines, which are all test positive for glyphosate, even organic. And if you don't know what glyphosate is the active ingredient in Roundup. And so these are the things that I was doing. Again, that was like probably 5 years ago. So I thought, geez, that's probably not a good habit to have. How do I change that? So what I ended up doing was I knew if I were to come home and start cooking that I really wanted to have that glass of wine because I had developed that habit, and it takes 66 days to develop a habit. And I'll talk about that in a few more minutes. So I went on and I said to my husband, I said, well, to help me, I would like for you to start dinner, and I'm going to go upstairs and do some stretching. So that just by implementing that I cut that off and then started doing the stretching. I'm 4 years into that same habit. Happy to say that I really don't drink wine at all. I drink it, but not like that. Okay, like it's like very specific type of wine from a very specific type of region in Italy, and an amount that I can handle. And it's usually a finger, like not a finger vertical, a finger horizontal. So it's like 3 centimeters of wine. Like it's probably, you know, 2 ounces less than that. So, and that's it. And that's not every day. That's probably twice a month. And so now I was able to change that habit. So if you're struggling with a habit that you've started, that might be a way for you to change that habit, is to just do something in that period of time that's different and then get into it. That would be one of my tips for you. Let's go to the next slide, please. Okay, so just a few reminders here. Start small, okay? This is a journey. It's not about, oh, I got there, look at me, I'm a clean eater, I'm so perfect, my immune system is 100%. It doesn't work that way, okay? So it's just one small step of understanding. It's really an awareness campaign. It goes back to what I had said to you earlier. Is this item going to help me, or is it going to hurt me? If it helps you, you take it. If it hurts you, you try not to do it, right? Also, a big part of what I teach in my course is to take the wins. That doesn't mean you don't acknowledge the missteps, just means you don't focus on the missteps. So it's like, oh, you know what? Oh, I did have more than X that I should have had, or I did have that salty snack when I didn't want to do it. But then what did you do that day that you took the win on? So focus on the win, but acknowledge the misstep. And that's the importance of that journaling. If it's accessible to you, ask for help. And sometimes it's easier to ask for help through a stranger. As weird as that sounds, it's because there's no real judgment coming in. So if you're able to, but for me, our store is very therapeutic. So I hear a lot of stories. I help a lot of people. Because it's a safe place. So if you can find something like that, or somebody like that, or somebody that you trust, that you know that you just can have a frank conversation with, and you feel okay with asking for help, I strongly recommend that. And like I said earlier, it takes 66 days for a habit or behavior to become automatic. So even just the 5 minutes a day can turn into something wonderful if you stay consistent. And let's go to the next slide. Okay, another idea here of crafting community. That's what we do in our store. What I've done specifically is create a support system. It's incredibly important for your mental health. And believe it or not, the studies are showing that loneliness and isolation can have incredibly detrimental effects on your physical health. And I'll just tell you real briefly, for a fact, okay, I spoke with one of my favorite customers. I've never met her in person. I've only met her through just from the phone, talked to her once a month. She lives in Vista. She's 92 years old. This is the first time in over 70 years she's a piano teacher, that she is completely alone, completely, okay? And it is wreaking serious havoc with her mental health. And of course, nobody wants to visit because they're afraid that if you go and visit, I don't want to be the one to get, not me personally, but I'm just saying, people are thinking, I don't want to be the one to give her COVID in case that happens. And this feeling of loneliness, I could tell you 100%, those approximately 380 trillion viruses will take advantage of this, the existing ones, okay, because her immune system is going to go down. So it's not just about her mental health, it's the whole system and how the whole system of the body works. So being alone is actually detrimental for her, okay, not just her mental health, her physical health. So now it's more important now than ever to find your tribe. Sometimes that means stepping outside of your comfort zone, which can be scary, but more often than not, other people want to connect just as much as you do. And that too is a fact, okay? We're social beings. We want to be connected. We need to touch and feel and be connected and feeling this way. So as much as possible, if you can do that, bring that back, that would be great. And next slide, please. Okay, so our conclusion here is, I think you get the picture. Your mental health is a complex and multifaceted factor of life that every single one of us will struggle with at varying degrees throughout our lives. And just look at my 92-year-old. She never struggled with it until now, 92. Although eating a certain way will not cure depression entirely, it is important to give our bodies the best possible chance to heal along with our minds. New studies are showing promising results from using a whole body approach to wellness, and it is undeniable that all of our systems are connected. Sometimes the best way to solve a problem is simply by approaching it from a different angle. The more tools you have in your tool belt or toolbox, the better you're able to handle whatever comes your way.